walang magbago o taas pa rin, hindi bababa ang lagnat niya.
Huli na nang matignan siya ng doktor.
Naging dengue hemorrhagic kasi nagkaroon ng bleeding. Kasi hindi naman na kita kaagad nung may sintomas na. So, nung dalhin sa hospital, stage 3 na.
Sa Rojas Capiz, halos mapuno ang ospital na ito sa dami ng mga nagkakadengge. Sa pasilyo nagtsatsaga ang ilang pasyente dahil wala ng bakanting kwarto. Nagdeklara na ng dengue outbreak sa lugar ang lokal na pamahalaan. Sa Zamboanga City naman, nagsagawa na ng clean-up drive at fogging ang lokal na pamahalaan para masugpo ang dengue. Mahigit triple na kasi ang itinaas ng bilang ng kaso ng dengue ngayong taon sa Region 9 kumpara noong nakaraang taon. Sa buong bansa naman, umabot na sa 106,630 ang kaso ng dengue mula January 1 hanggang June 29. Mas mataas ito ng 85% sa parehong panahon noong 2018. At dahil patuloy itong tumataas, sa kauna-unahang pagkakataon ay nagdeklara na ang Department of Health ng National Dengue Alert. Idineklara na ring epidemic ang dengue sa ilang bahagi ng bansa, kabilang ang Memaropa, Western Visayas, Central Visayas at Northern Mindanao. Nasa alert threshold naman ang Ilocos, Cagayan Valley, Calabarzon, Bicol, Eastern Visayas, Zamboanga Peninsula, Davao, Bangsamoro at Cordillera Administrative Region.
Dengue cases have been observed to peak every 3 to 4 years. And I would like to emphasize that early detection, proper case management, evidence-based, clinical best practice case management can prevent deaths.
Sa tala ng DOH, 456 na ang namatay dahil sa dengue ngayong taon at kadalasan ito ay dulot ng komplikasyon dahil huli na raw dinala sa ospital ang pasyente.
Ito yung hemorrhage, ito yung internal, of course, bleeding, the heart is affected, the other organs are similarly affected, liver, kidneys, and so this is the reason mainly is because of the late stage complications which are rather deadly. That is why early detection is so crucial.
There's no available vaccine for dengue in the Philippines for the past 2 years, so we find no connection between the areas where dengue vaccination was given previously and the number of cases that we're having now. So we don't think there's any relation.
Ayon sa World Health Organization, hindi lang sa Pilipinas nararanasan ang dengue outbreak ngayon at nasa 400 milyong kaso ng dengue ang naitatala sa buong mundo taon-taon.
Probably many factors that contributing to this. We have a change in the world, we have a change in lifestyles with increased mobility. We also have a change in the climate that we are observing that will have an influence also on the prevalence and presence of dengue.
Paalala ng DOH ang 4S para maiwasan ang dengue. Search and destroy mosquito breeding sites, self-protective measures, seek early consultation at say yes to selective fogging.
Mosquitoes have congregated in the corner of a classroom in Zamboanga City. Though small, each may be carrying an illness-causing and at times deadly dengue virus. From January to June, almost 107,000 people in over 10 regions were affected with dengue. Most are in Western and Central Visayas, Calabarzon, Soc-Sargen, and Northern Mindanao. The virus is quickly transmitted through mosquitoes, and it's already affecting many people in Memaropa, Western and Central Visayas, and Northern Mindanao. Health officials expect a peak in dengue cases this year. So, for the first time, they declared a National Dengue Alert.
Observe dengue spikes every 3 to 4 years is really a phenomenon. We want to raise awareness among the public.
Considering the numbers that we've seen already this year, we have to brace for a severe dengue epidemic this year.
While dengue is epidemic only in some regions, health authorities have advised the whole country to help prevent dengue transmission. This includes destroying mosquito breeding places like stagnant water and wearing long sleeves or applying insect repellent. Early detection is also a must. 456 people have died of dengue since January, many of them 5 to 9 years old. Health officials say death may be prevented.
They are brought to the hospitals rather late in the stage of the dengue infectious process, that means that the complication, third stage, has already been reached.
Pag may lagnat yung bata ng 2 or 3 days, kailangan dalhin na agad sa center or sa hospital because we have a rapid test that can detect if it's dengue or not.
Aside from having more hospital staff ready, there will also be selective fogging within half kilometer of areas with confirmed dengue cases.